So I'm pressing towards the heel, like from the side.
No, I'd push up. So
yeah. Through the sole of the shoe.
Yeah, because that's how it's going to compress, right?
Yep.
So when you stand
okay.
it,
So you kind of pinch it. I kind of pinch it on the inside, like this.
Yeah. Okay. Yeah. And so if it's relatively hard, it isn't giving much.
Barely giving at all, I'd say.
Okay. So then you'd score that as a 0.
I'd say it's giving about 1 millimeter. With a hard squeeze, I can get. But even just when you get that question from a runner, what shoe shall I buy? Trying to give a somewhat evidence-informed answer to that is just extremely difficult. And they often bring their running shoes in and expect me as an expert, quite reasonably, to be able to look at them and say, this shoe does this, and this. And I was reading your, I think you'd done part of your PhD, a study where you interviewed clinicians. I don't think it was meant to be funny, but it was quite funny. Like just all over the place we are. And it's so true. Like we really don't have any structured way to approach analyzing what like quantifying what a shoe is and what it's doing versus another shoe. So that's what caught my eye about it. And then is that where you're going with your research in the future, trying to assess and analyze and investigate shoes?
Yeah. So I want to, I'm kind of all over the show with what I'm doing with my research. And I have a friend that I met back in Australia who is living in Tokyo, but we met up in Australia last year, and she got this kind of odd postdoc that's not your typical research-based postdoc where, she's doing research, but she does it in kind of these innovative, just different ways of looking at the same sort of question. And so her pathway to her topic is something with shoulder injury or something, but what they were doing was going onto blogs and websites and evaluating how good the website is and what sort of information is out there and whether it's evidence-based and that sort of stuff. And so her and I met in Australia and started having this conversation about that the manufacturers probably are at the top of this tier and are influencing footwear retailers, clinicians, of course, the buyers and runners themselves, but and then probably in a wider aspect when we start thinking about like the new performance shoes and their impact on like the international Olympic committees and that pendulum swing is actually quite interesting because never before has there been any sort of concrete, objective data restrictions around what shoes can and can't be. We've had restrictions on like the length of spikes and the material of spikes, but never about the actual geometry of a shoe. Okay. And so with the new Nike, whatever it is, Vaporfly, they made all these restrictions with the Olympics and international track and whatever else. And that's never been done before, where the midsole has to be a certain thickness and it can't have certain features. And that's never been present before. So I think that there's a whole lot of connections between a whole lot of different actors in this that need to be properly linked together and have a streamlined bit of information where everybody can speak the same language. And so it does come back down to clinicians are probably the easiest target because they're usually, like yourself, frustrated with trying to figure out the literature, confused with what the literature actually says because everybody talks in these ridiculous sort of colloquial languages. And I'm guilty of that myself. And then they've got their patients coming in and adding that pressure to it. And then of course you're limited in the amount of time that you can dedicate to this. So if you want any sort of work-life balance, you've got 30 minutes blocks that's where your payment comes from. So you can't spend that reading literature all day long and trying to figure it out. And so you have to do that in your spare time. And yeah, it's really frustrating. And I would love to be able to just help start making the links between things. And there's lots of ideas that I have about that. One of them is using that tool where we objectively actually measure shoes. And the key to that is that you would have a patient that comes in, multiple times over their training period or whatever, and you're continually assessing the changes a shoe makes. And I haven't done a study longer than 12 weeks, and I'm still working on the paper for this, but over 12 weeks, that's not very long. I think the people that I had in my study they ran a total of like 800 kilometers or something like that over 12 weeks. And it can't even be that much. It's got to be like 400. And their shoes changed immensely, just from the wear that they put on them, the temperature, I don't know, the different surfaces that they run on. And it was real interesting. I didn't find any links to injury and those changes, but I didn't have enough people to really run that sort of analysis either. But it is just interesting, and it's a starting point.
So how did you analyze those shoes? Did you use that FAST tool or?
Yeah, I did.
So could you explain a little bit for people listening, like what that is and why we might be interested in what it says?
So I was influenced by a clinician about this tool. So I didn't develop it, but I got really interested because a clinician that I had talked to uses it a bit informal to assess his patients. And so they'll come in and he does some sort of dynamic task with them barefooted, and then has them put their shoes on and does the same sort of dynamic task. And if they can't perform the task the same set of shoes as they could barefoot, then there's something going on with their shoes that's not allowing them to move. And this kind of falls along that natural motion control, or whatever, not the motion control, but the natural movement paradigm that Ben O'Neill kind of has stored in his corner. And so it kind of falls along that. But what it does is it measures down to the millimeter the medial lateral differences. So from the inside to the outside of your shoe, whether it's either thicker and or harder, which we know a lot of shoes are built with that medial post where it's supposed to be a motion control. And so if you're listening to that Bartold podcast, he had, I don't remember who it was on, that was talking about how motion control, he worked for Nike, and motion control was 100% a marketing scheme from the get-go. They just made it up.
Okay.
And so by being able to quantify and measure how much difference there is between the medial and lateral side of a shoe down to a millimeter, you can start making adjustments. So let's just assume that it's a typical motion control shoe. And if we think about, if you think about standing barefoot on the ground, the alignment of your ankle, knee, and hip, we would assume in a healthy person, there's lots of pathologies and stuff that we're just going to ignore for now. But in a normal healthy person, even if you've got some soft tissue injuries, the alignment of your ankle, knee, and hip standing barefoot logically should be relatively aligned. Okay, and then when you start adding even 3 or 4 millimeters of a medial post, that alignment shifts. And so then you've got soft tissues that are having to try to pull back the structures to get it into an alignment, and then we're overloading them. And then you try to do like one-legged dynamic tasks, as in running, where we spend a moment of time on each leg several times over, let's just go the course of like a 5K. How many steps do you take in a 5K? That's a lot of times that you're loading that structure kind of in a wonky angle and having to use all of the soft tissues and muscles and whatever to try to bring it back into its natural position. And so by being able to measure what that difference is, clinicians can go in and either prescribe a new pair of shoes that is going to allow your patient to stand as if they were barefoot, or in the most comfortable position for them. And I use comfort very cautiously here, but or you can start adjusting the shoes. And this is what this clinician that I was influenced by is that he'll take pieces of rolled up newspaper and tape them to the inner sole, just to make like a 1 millimeter adjustment or 2 millimeter adjustment. And it's just trying to balance out a shoe that is asymmetric or isn't allowing a person to move in the way that they should be moving.
Currently, would it be fair to say that most shoes that are sold have this kind of tipping, for want of a better word, to the outside of the foot? Would that be, is that pretty typical of the shoes that you've looked at?
Yeah, and a lot more are neutral than what I expected. But yeah, you're right that most shoes are actually, tipped towards the outside. And the problem with that is that our natural strike pattern for most runners is a rear foot strike, and you strike on the outside of the shoe. And so, so that you hit your heel on that back corner. And if you flip over anybody's shoes, you can see, you're a heel striker and you have a typical pronation pattern. And pronation has been such a bad word in running for so long that part of what I would like to do is bring a little bit more positivity to that, because pronation is not a bad thing. That's what we do. That's how we move. And there's lots of issues with pronation, measuring it statically versus dynamically. And in a dynamic movement like running, it's normal. That's how our body is intended to do stuff, especially if we're landing on our heel first. There's different issues with being a forefoot striker, but heel strikers land on that outside corner and wear the corner of the shoe down. And so if we think about going back to standing in an asymmetric shoe with that, if it's tipped to the outside, and then you've got a pair of shoes that you've worn for 700 or 800 Ks and have constantly worn down that outside corner, that tilt has gotten a lot worse. And so over time, your body's had to adapt to greater and greater moments of displacement, I guess, from that original position.
So then, say, if you were to look at some shoes, would you sort of, perhaps using this tool or maybe some other assessment means, but you would look at the shoe and instead of sort of going with what it's been sold as, like let's say a motion control or a minimalist or whatever, you would look at it and try and decide, this shoe is going to tilt them more outwards or this shoe is going to tilt them more inwards. Is that the sort of lens you're looking at it through?
Yes and no. So yes, I would be able to make that sort of judgment, but ultimately you have to have the person involved. So a runner has to come in. You have to know what it is that is going to work for that runner. So it might be that somebody really struggles to do stuff barefoot, and we put them in a shoe that allows them to move much better. Number one, I would probably say let's strengthen that person so that they can work more properly barefoot, because shoes are technically a brace, aren't they? So any sort of bracing that we do in any other aspect of rehab or any sort of treatment, a brace is only there long enough to get you back to a normal state or to a healthy state. So, I mean, we just habitually wear shoes and are habitually in this braced state of movement. So getting people to be able to function well without a brace on is the top priority. And then being able to, I mean, shoes are a necessity. We have to wear them. I don't run barefoot, but I do make sure that my shoes are allowing me to do the things that I can do barefoot. Mm-hmm. And so, like, I'm not willing to run on rocks and roots and whatever else without shoes on. Some people do, but I'm not into that. So, shoes are just a necessity, and we have to be able to use them, but they shouldn't be hindering us from what it is that we can do without them.
Yeah. And it almost sort of, I don't know if you've ever come across that question, but I get it from clients often who've got orthotics, right? So inserts for their shoes that have been custom molded to their feet, and then they've usually paid a lot of money for them, and they say, what type of shoes should I put these in? And I'm always, it's another one that sort of stumps me, because, a neutral shoe, as you said, wouldn't be neutral after a certain amount of kilometers. And certainly when I look at, neutral shoes, they're not perfectly flat, are they? They're higher at the back than they are at the front. They often have a little bump on the inside near the arch. They're not. Is there such a thing as a neutral shoe? Is this a category that exists in a motion control shoe? Are these defined categories? Are these convenient words to use that maybe don't actually mean what we think they mean? I guess is.
Yeah, I really struggle with that. So I've done quite a bit of work in the literature, and kind of coming back to my friend that evaluates websites. We went in just this past few months and have been looking at manufacturer websites, and that paper is underway at the moment. And it's so confusing because a minimalist shoe to you is not the same minimalist shoe to me. And that's probably not a good example, because there is a definition for a minimalist shoe at the moment, but there hasn't been up until the last 5 years. And for all other types of shoes, like, what's the difference between a motion control shoe and a stability shoe? And those are two terms that are used very separately. They're used separately. And then, what's the difference between a neutral shoe and a everyday shoe? Like, that's an actual term that's been used, everyday shoe. And so when I started going into the literature looking for ways to actually quantify and understand, what types of shoes are good for different types of people, I couldn't combine any of the data. And that's essentially where my research has started, because it was what I wanted to do was find out, this shoe is good for runners or this shoe is bad for runners, but I can't even get past this shoe because I can't define any of it. Mm-hmm. And so that's a big project that I would love to tackle. And I've had some good conversations with people over the years of being able to actually define all the different types of shoes. And Canadians are good at footwear stuff. So there's Jeff Schuler at British Columbia that's doing some cool stuff with the Minimalist Index, which is, it's a different tool. And he's doing some really great stuff with it. So he's got his own website, where they have a website applying this index to all different types of models. So you can go on and understand what index each shoe is. But the problem with it is that there's only one outcome. So you end up with a score of 0 to 100. So I'm probably gonna mess this up. I think the higher the number, the more minimalist it is.
Yeah, I think that's right.
Yeah. And so, if you've got a shoe that's 85% minimalist, let's just say, there's 5 or 6 different factors that play into that. And so still, a shoe that's 85% minimalist, we can have 2 different brands that are 85% minimalist, but are going to have different features and different, it might be this fluctuation of different numbers that ultimately come up to 85. And so it's a really good starting point. And I think it should be included on the box when you buy shoes, that, these are the numbers, that this is what it comes out to be. And that way, as a clinician, you can know, so if it's printed on the box and is printed on the website, that this shoe is 85% minimalist, here's all the stuff when it was manufactured, you can log in, look at that and go, right, this shoe isn't this anymore. When you've got a person that comes in that's injured or whatever, and you can help people transition between different levels of minimalism. And I think it's a really good starting point. There's lots of other things that I think can be added into it.
Yeah, I discovered that a few years ago. I did that course actually, and then they talk about it. And I think the difficulty I have with that is it sort of starts from this point of and even the way they've set up the scale to be 100% minimalist, right? So 100%, it kind of implies, and I think this is a fair reflection of the beliefs of the people who teach that course, that the more minimalist it is, the quote unquote better it is in terms of all things being equal, it would be better to have a more minimalist shoe, which is a very difficult thing to apply in practice, because, most of our runners who come in won't be conditioned in their running and in their tissues to tolerate high levels of minimalism in their shoes.
Sure.
So it sort of starts from, so say you started putting that on the box, 85% minimalist, and then people are going to start going up. Now, depending on what you believe, you may think that that's a good thing, right? The more minimalist they go over time, the better. But when I've read your work and some other work, when you look at the evidence that connects running-related injuries to shoes, there doesn't seem to be anything hugely convincing to say this type of shoe makes you more or less injury prone. Is that a fair assessment on my part?
Yeah, absolutely. There's no evidence. And I really struggle going into shoe shops that have, they do a gait assessment and will tell you that, you're a rear foot striker and you pronate, so you need an anti-pronation or motion control shoe. I really, really struggle with that, because for over a decade now, that has not been true. And we've seen it in huge, large studies that they've done it repeatedly and cannot come up with that answer. So assigning somebody a shoe because of how they run or because of what their foot posture is in a static position, we can't measure foot posture dynamically, right? So we have to have somebody stand there and we look at how far their arch falls to the floor and how their Achilles line aligns, but we can't do it dynamically unless we video them and break it down. But it's so hard and so confusing. Yeah, you're right.
I think part of the problem is that it's such a convincing and simplistic narrative to take someone's foot, take a slow-mo video and see it tipping inwards, and then put something under it and it looks like a nice straight line. And that's such a convincing narrative. I think that's why it really took hold of the footwear industry and the orthotics industry. And we don't have, as far as I understand, we have evidence that that's not correct, but we don't have anything to supplant it or to put in its place, So you mentioned a little while ago the Ben O'Nigg's team and their comfort filter. So just for the listeners, this is the sort of, it's the proposition that if you, the best guidance to how to choose your running shoes is the ones that will feel the most comfortable when you try them out, will potentially make you less prone to injuries. So that's sort of taken hold a little bit now, I'd say. You hear that a lot from clinicians who've read that study or ones like others from that team. But then I was listening to it wasn't a podcast, it was like a talk with, I've forgotten his name. He does Pod Chat Live. He's a podiatrist.
Oh, yeah. Adam Meekins?
No.
Anyway.
The name escapes me. I think it's Ian Griffiths, actually.
Oh, yeah.
So, and he was saying, he looked at the evidence for this comfort filter paradigm, and there didn't seem to be much. There didn't seem to be much at all. And I was just wondering what your thoughts are there. Is it a fair thing to say to a runner, choose the shoes that are comfortable? Or would the more honest answer be, we don't have any evidence to guide you in selecting running shoes currently, so get the ones that look good,
Yeah. And I mean, I'm guilty as well as every clinician out there at the moment that has given that advice, that you just pick something that's comfortable, because to me, that seems like the easier answer than doing an assessment and saying to somebody, your arch falls in when you run, so here's a shoe to fix that, because that goes back to that bracing pathway. Like we need to, if somebody's arch is falling in while they're running, and they seem to do better when you brace it, well, let's strengthen them so that they don't have to brace it anymore. But the comfort thing, it does seem to be the easiest answer. And I've been guilty of doing that to runners. And I've started kind of holding back after Ian had done some of that work. And it is a bit more convincing now that actually, your comfort changes, and standing for 5 minutes in a shoe store where you maybe get to run on a treadmill. The last time I've ever done any training on a treadmill, I was probably 19 or something like that. It's been years ago. So I don't run on a treadmill, and that's completely different than running on the trails and doing all the other type of running that I like to do. So it's not going to be indicative of how comfortable that shoe is for me or anybody standing in the shoe store. What would be great is if we could go out and run for a little bit and go, actually, I don't like these, and bring them back. And there are some shoe stores, some specialty stores that do that, which is amazing. And then, if the shoes are too worn to put them back on the shelf and sell to somebody else, then they donate them and take one on the chin, I guess. But I would love to see that happen across the globe, that, if you don't like a pair of shoes after, let's say 30 days, and you bring it back and get something else, try a different one. I've got a pair of $400 shoes that I hate.
Why do you hate them?
Well, I changed model just slightly. So I thought, I'll have a lazy pair of shoes. So I've got my normal ones that I run in that make my calves and Achilles work quite a bit. And then I was like, I'll get just something to be a little bit lazier in for easy days, and days that I'm tired and I don't necessarily want to have to work all that hard. And they're horrible. They're too cushioned. I can't feel anything. I hate them. My toes hit the end of them, even though they're the same size. I just hate them.
That's the other trouble.
So much money.
Sorry to interrupt. I was just going to say the other trouble with that comfort, it's like you say, it's like comfort is contextual. Like, if you have a very strong belief that running barefoot is a natural way to run, and then you put on some 5 fingers, they will feel comfortable to you because you have a perception that this is a good thing. Whereas if you believe that you shouldn't feel anything when you run, like in those, you just said, I can't feel anything. They're too cushioned. Like, that's a different approach. So you could end up like 2 different people coming in with different beliefs. One that leaves with some 5 fingers and one leaves with some hawkers on the same comfort paradigm. And we have no idea what that does to their biomechanics, to their training habits, to their, the forces that their legs experience. We don't know what those two shoes do. Or we know bits, do you know what I mean? But we don't know which would be better for that runner. So it feels like a little bit of a cop-out to me. The comfort, I get it, and it's a little easier for me as a clinician, but it doesn't feel any more scientifically robust than the line up the heel kind of position that I sort of had 5 years ago. And I guess as a clinician, that's part of the reason I liked what you were saying, because I wondered if maybe some of the difficulty in finding any really strong links between types of running shoes and running injuries is because we've been throwing people into studies without being able to properly quantify what that shoe is. So we may have been comparing or putting people in a group that actually didn't have the same shoe, so if one was running in shoes that were 6 months old and another person in that group was, brand new shoes, if you assess them with your tool, you might find that shoe has a completely different biomechanical effect. So do you think that might account for some of the all over the placeness of running research on shoes?
Oh, absolutely. That is 100% where my frustration with this whole topic started, was that I had no way of understanding, because when I did a systematic review and looked at all these different studies and was trying to go, okay, well, from a research perspective, what's the best shoe that I can give to the people that I want to study? And so I looked at the literature to try to determine that, okay, well, all these studies, these people got hurt because they're wearing these shoes. And when I went to compare them across the board, I think I had like 30 different characteristics that were explained across, 15 or something studies, 25 studies. And none of them were consistent. I couldn't combine two studies together. And because they used different shoes, they used different ways of describing shoes. So let's just stay with the neutral topic. I think I don't remember exactly what I wrote about, but I might have had like 8 studies that used a neutral shoe, and the way that they determined that shoe is neutral was different across all 8 studies. Right. So one might have just listed that it was the manufacturer that said that it was a neutral shoe. Some of them might have done some sort of measurement on it. I don't know. It's all over the place, and it is extremely frustrating. Yeah.
Yeah, it's an unsatisfactory endpoint, isn't it? Too.
Yeah.
It's like, what's the take home here? It's very tricky to arrive at one for what to do when you get these questions like, what shoes shall I buy, or are these the right shoes for me? It's yeah. I guess it would be nice if we had, at least, like you said, something like this tool where it's like, okay, well, these ones are tipping you a bit more outwards, or these ones are pretty flat. Do you get any that are tipping inwards, or is that just not a thing?
No, there are some, especially, there are some that are designed that way, that have a lateral post in them. More, and the interesting and longer, bigger picture that's interesting about this, and there's plenty of counter arguments but if we look at medial knee osteoarthritis, which is really common, one of the quick fixes for it is to stick a lateral post in to change the position and offload that medial moment on the knee, which is really interesting because we do exactly the opposite in prescribing footwear. And so we load the medial side of the knee. And to me, osteoarthritis is the ultimate overuse injury, right? So it's just been hammered down for so long. And so what would be probably a lifetime goal of mine in research would to look at a longitudinal, decades worth of people wearing a motion control shoe and what the link to osteoarthritis is after that, because it's loading that medial side of their knee, the inside of the knee. And so running shoes particularly don't always have that lateral post in it on the outside where it tips inwards, but that is a treatment for people with medial knee osteoarthritis, that they stick a wedge in to the outside of their shoe just to offload the medial side and bring structures closer to the midline of the body. So I find that really interesting when we kind of zoom out and get away from just running, but look at the long-term effects of, lower limb injuries. That's really interesting to me. And going back to what you're saying about how there's different shoes, even within a single study, that if we are not measuring them, that's probably why some of the variability exists and that we can't come up with any single answer. I've had this conversation with other people before, that you and I could go to the shoe shop together and the same store, buy the exact same shoe, the brand, the model, at the same time, and they can be completely different because one shoe might have come in from a shipment from, let's say, Vietnam. The other shoe might have came in from a shipment from the US. They use different foam, different manufacturing, it's different climates, and they might have used different adhesives to put all the materials together. There was a case study that I read from, I want to say that it was like 2000. So this is 20 years old, this case study. And there's a guy that presented Achilles tendinopathy. And the clinician that wrote the case study identified that there was kind of a manufacturer flaw in the shoes. And of course, it was just a one-person case study, but the shoe that was on the same foot as the tendinopathy, the upper was kind of glued at an angle. And so that guy's foot just didn't sit quite right in the shoe. And so there's those sort of issues too, that like the shoes just are not made the same based on where they come from. The polymers are different around the world.
Would there be any way for us to account for that kind of thing? Say in a sort of clinical environment, looking at a shoe, could we assess that kind of thing, or is that just sort of it's something that we can't control for?
Yeah, I don't think so. Not at the moment, and that's part of my approach to the bigger, wider issue of, that I think manufacturers need to take a bit more responsibility for the products that they're putting out. I would love to, actually, this would be an amazing thing for me, that, when you open a can of tennis balls and it does that like, shh.
Yeah.
I think we should be able to do that with shoes, because EVA is a biodegradable material. So sitting on the shelf, that shoe is sitting there degrading, whether you're using it or not. And so, I hear a lot of runners go, oh, I bought 10 pairs of the same shoe because I heard this company is not going to make the model anymore. And so they go buy 10 of the same shoe so that they've got the same shoe for, the next 10 changes that they need to go through. But by the time they get to the 9th or 10th shoe, it's been sitting in the closet for years potentially, and is not the same as they bought it 5 years ago or 2 years ago or whatever, because EVA is biodegradable. I mean, not real fast, but it does degrade. And I mean, other materials in shoes degrade also. And I mean, then there's the whole issue of what do we do with old shoes also, which is, I mean, there's landfills full of shoes somewhere.
Yes, that is a topic that's too big for me. I can't handle it right now. I mean, that's just my perspective on things. It's huge. It's a huge issue. You mentioned, about the foam and the fact that it degrades, and the fact that, it wears down with time and changes the way our foot interacts with the ground. When I was reading one of your studies, you'd used this, I believe it's called a durometer, like a density measuring tool. Could you describe, just for the listeners, like what that is is this something that we need in order to assess shoes, or can we just measure them like with a ruler? How applicable to the real world is this? Or is this more going to be in the research setting?
Yeah, I mean, durometers are relatively accessible. You can get them at, they're real common in like material testing. And like if you go to your local tire store, they'll test the hardness of the rubber on your tires using a durometer.
Okay, I didn't know that.
But there's lots of different kinds. And so the kind that I use is for soft foams. And yeah, it's all it is. It's just a spring-loaded, little ball that's on the end of this reading. And it's just a scale and its own arbitrary units of hardness. And you just press it down on the foam and it gives you a reading about how hard that foam is. And so 100 would be wood. So if you push it down on the table, it should read all the way to 100. And so less than that is, varying degrees of hardness of foam. There are some people from, so I need to use this validity or do this validity of using this tool in measuring footwear in this way. It's super reliable. So if you can get your hands on a durometer, you and I can measure shoes very reliably between the two of us. But the validity of it, I'm not 100% sure. I feel like it would be pretty good. I don't know what else it's going to be measuring, but there is a way to just manually do it because the durometer is quite expensive. And so having one accessible to all clinicians is difficult. And so there is a way to manually do it, and you just give it a push with your thumbs. And if it's relatively hard, you score it as a 0. If you can get a fair bit of give into it, you score it as a 1. If there's a lot of give, so if you take like a Nike Free, if there's a lot of give in it, you score it as a 2. And that just has to deal, so those numbers get translated to millimeters, and then you combine that with a measurement. And I use calipers, but you could use a ruler all the same. And so let's say that the medial side is real hard, and then you go over and measure. So you give that side a 0. And then you go over and give the lateral side a squeeze, and it's really soft. And so let's say we give that one a 2, but the thickness is the same. So let's say that they're 25 millimeters on each side, but one's really hard, one's really soft. So that means that there's 2 millimeters of difference towards the outside of the shoe. So it's tipping you 2 millimeters when you're standing in it. And so, yeah, there is a way to, but then, as that shoe wears, that will increase. So if we're wearing out that outside of the shoe over time, it's not going to be 25 millimeters on each side anymore. It might be 25 on one side and 23 on the other, and still hard and soft. So now we've got 4 millimeters of difference over time.
Okay, we're reaching some point of actual useful information instead of just telling people it's hopeless. So let me grab my shoe. 1 sec.
Okay.
Okay, so these are relatively new. Sorry for the people listening rather than watching, but click the show notes and you'll see the video. So if we're looking at the back of the shoe here, if I was going to do the finger test of how firm the foam is, where am I going to push?
So if you turn it sideways. Yep. Okay, so if you were to go right where you're, so clinician talk here, what is that, the medial side, or is that the lateral side?
That's the lateral side, sorry.
Okay, yeah. Okay, so if you go from where your malleolus would go and just go straight down, yep. Okay, yeah. So give it a push there.
Okay.
Yeah. And so if you can just try to press it in and see if there's any give.
So I'm pressing towards the heel, like from the side.
push up. So yeah.
through the sole of the shoe.
Yeah, because that's how it's going to compress, right?
Yep.
So when you stand
okay,
it,
so you kind of pinch it. I kind of pinch it on the inside like this.
Yeah, yeah. And so if it's relatively hard, it isn't giving much.
Barely giving at all, I'd say.
Okay, so then you'd score that as a 0.
I'd say it's giving about 1 millimeter. With a hard squeeze, I can get it to squish about 2 millimeters. I think.
So, I mean, it's hard for me to make a judgment, but if it is real hard to, like, if you've got to really put some effort into it,
I do.
Yeah, I would still probably say it's relatively a hard foam. So
we need some sort of a equivocal. Do you know what I mean? It's as hard as. I don't know what it's as hard as.
Yeah, and so I mean that's a difficulty, right? But yeah, and then you do the same on the other side, and see if it's the same.
I'd say it's pretty similar.
Okay. Yeah. And so then you can measure the thickness of the shoe. Just grab a ruler, and like in the shop, I'll do something where I just take it on my finger, and so I'll just line my finger up, because I don't take all of this stuff into the shop, right? But line my finger up and I go, right, so it's this thick on this side, and then I just go over to the other side and I go, it's about the same thickness. So then I know that it is relatively close to being the same thickness.
So if we do a quick case study on this shoe, so I picked it up in the shop. I'm going to squeeze the two sides, like pinch them.
Yeah.
And actually, when you say, you're comparing one side to the other, that's a lot easier than just saying hard versus soft. So I could say, okay, well, for me, these feel equal. So it's neither going to tip me in or out. Is that fair?
Yeah.
But say this one on the outside was squishier, that's 1 point in the tippy out box. Would that be?
Right.
Okay. Right. And if it's a lot squishier than the inside, that might be like 2 points in the tippy out box.
Yeah.
Right. And then I'm going to measure with my finger. Again, I'm still in the shoe store, and I'm just going to put it sort of, it's right in the, if you were looking from the side for the listeners, it's where the heel is, it's sort of in the center of your heel bone. And the tricky thing there, if you look at these shoes, they have this kind of design wedgy bit. Yeah. So how thick is the sole?
And so I call that the fashion band. So it just goes around the outside.
Yes.
It's maybe reinforcing a bit of the glue and stuff that's attaching the upper to the actual midsole. But if you stick your finger down inside the shoe, and you can tell like where that's actually just coming up over the edge.
Yes. So if I do that,
I want to go.
Now I know where the top of it is. So I'm sort of pinching it from the inside and out. And it's actually on these shoes, you maybe can't see, but it's kind of, you can actually see it. You can see what is real sole and what's this bit of rubber coming up the outside. So now, okay, on the inside, if I do my little measurement, it's about 1.5 index fingernail lengths for me, which equates, I think, to about, a centimeter. And then on the outside, sorry, on the inside, it's a little more. It is a little more. Not by much. It's a few millimeters higher on the inside sole. The part of the sole that would be near the other foot is a little bit. So that would say potentially give it a slight outward tip to the foot.
Yeah.
So would you do it then for the front of the shoe as well? The same thing?
Yeah, and so that's where the nice thing with this one comes in, is that you can be, and I mean, it works for any strike pattern. And I mean, we always come up off of our toes anyways, whether that's where we land or not. But, and so if you know that when you're on your toes, which is probably your most vulnerable position, that's when you're the least stable. So when you're coming off, even if you heel strike and then you're coming off of your toe, and if that's not stable, you're really having to work quite hard to balance yourself out and be able to keep moving.
Yeah. Okay.
And so like I don't know, get a patient in and have them do like a heel raise task from like a dynamic squat, single-legged squat to a heel raise, and coming up off their heel onto their toes is really difficult. And so then like even in a barefooted position, you could stick just a small wedge underneath one side of their foot and just watch them wobble all over the place and potentially maybe not even be able to get up onto their toes. And so by measuring both the front and the back of the shoe is quite important, actually.
Yeah, I hadn't thought about that before. And as you were talking, I was having a feel of the front of mine, and definitely there seems to be more than, there's the form feels similar, but there's definitely more sole on the inside near the big toe than there is on the outside. And like you said, if I was standing there doing a calf raise and then someone put a little wedge under my big toe and I was doing a one-legged calf raise without holding on to anything, it's just going to tip me over.
Yeah.
So obviously that's going to increase, obviously I shouldn't say that, potentially that's going to increase the stress on the muscles on the outside of the ankle. So those that would prevent spraining or rolling, it's the perineal muscles. They would have to work harder to counterbalance that. And I mean, at least that is a way of looking at this objectively, instead of just saying this is a neutral shoe. At least now I have some concept of what it might be doing to the foot that I can start with. I guess the question, though, is what you're looking into is what we did valid? Is it really measuring what we think it's measuring? Would you say there's enough from your work to say, yes, it is, or no, we need to look into it more?
Yeah, and I mean, I think that it's pretty valid. Of course, I don't have the information to back that up, the research to back it up, but I mean, it's relatively simple. It's just looking at hardness and thickness. And when you combine those two together, does it give us a reading that is conducive of that? Sure, I'd say yeah. But yeah, let's test it out and find out whether it is actually valid. And I mean, ultimately, it'd be great if we could get manufacturers to report these sort of things. And it was really interesting when I was looking at the websites and going through all the different specs that are reported about shoes. I was also shopping for a new mountain bike at the same time. And you go to mountain bike websites and it tells you, I mean, down to millimeters and ounces and everything about every single different component of a mountain bike, but not with footwear. I presented this data just at this conference a few weeks ago, and I think there was only 6 or 7. So we looked at 24 websites and 80 different footwear models. And out of those 80 models, there was only about 4 different objective specs reported.
Right.
So heel toe drop, weight, or the mass of the shoe. And then there was a few that reported the actual stack height. So it's not much different than heel toe drop, but at least you know that it's what the drop is coming from and what the actual measurements are. But that's about it in terms of specs. And all the foam is proprietary and trademarked, and you can't compare any of that stuff because they've all got their own special whatever it is. But the hardness of it, nobody reported hardness.
Yeah. Okay.
In any website that I looked at, any of the manufacturers.
If could we just back up for a sec, just for listeners there? So heel toe drop, not everybody knows what that is. The other thing you mentioned was stack height. Could you just explain what those two things are for people listening? Yeah.
So just the stack height is the height of the. So what you were measuring on your finger. So the height of the midsole at the back of the shoe, and then again at the front of the shoe, and then heel toe drop is the difference between them. So A drop of 0 means that it's the same height at the rear foot and the forefoot. I don't know. Shoes vary from 0 to 12 or 14 millimeters of difference. So, and there's different repercussions from that, depending on what your body does. But yeah.
And then, did you look, because we've been looking at inside to outside foot shoe, and what I mean really is, like, if you're looking at one shoe, we're looking at left versus right hand side rather than inner and outer. So it's inside being the left of the right shoe, outside being the right of the right shoe. But there's also like heel end and toe end. So is there do we need to also look at, the difference in hardness between the heel and the forefoot, and whether potentially, if you've got a lateral skew on the back? Sorry, I'm using my stupid words. If you're tipping outwards on the heel and you're tipping inwards on the forefoot, do we need to also quantify the differences between the back and the front of the shoe as well as the inside and the outside of the shoe?
I don't know. Essentially, my FAST tool does do that, because I give a reading for both the forefoot and the rear foot. But in terms of what you end up doing with that, is kind of up to you, I think, as a clinician, like whether, because what you described, if we've got it kind of twisted, essentially, is what you were saying, that is indicative of a typical movement pattern if somebody's shoe looks like that after it's been worn for a bit. So let's assume they started with a neutral shoe, but then as they come in after so much use, it ends up looking twisted. And what you can essentially say to them is, yep, you run pretty normally. You heel strike on the outside of your heel, you roll inwards and push off with your big toe. And your shoes show that, and you need a new pair of shoes because these ones are worn out. I don't know how many are actually made that way. I would probably be a bit surprised if they were, but yeah. Okay,
but then it's coming back to at least having the ability to assess that. And it doesn't sound like, you're talking about making clinically valid tools for clinicians like me to help with people who are injured. But, you also mentioned manufacturers, and, if a runner's going into a shop and it's very difficult to say, to say blanket to runners, you should get X, Y, or Z type of shoe. Obviously you can't say that, but what are the things that you as a runner would look at and consider?
Do you still have your shoes sitting there?
Yep.
So the very first thing I do is I flip it over and look at the bottom of it. And I look for, usually, you're a bit of a trail runner, so usually I look for a solid piece of rubber along the bottom. So that one's got a few different pieces, but if you look at the front of it, there's those green stripes that run down right in the middle of it, and I would take a look at that and set it back down, because those type, that's two different types of rubber there.
Okay.
They might look and feel the same, but they're going to wear differently.
Right.
And what I want is something that's going to wear relatively uniform. I don't mind so much if the front and the back are two different types of rubber, because you use your shoe at different points, but across from the medial lateral side, I want it to be one solid piece.
Right. Okay.
And then the middle where it says Saucony on it, and this is not an ad for them at all, but as long as that's not a restrictive piece of plastic or something like that, lots of shoes have that chunk of plastic in the middle of it. So
you're wanting essentially something quite uniform across the bottom. Would that be fair? So nothing too fancy in terms of what they've done playing around with the design of it. Like they've added these little green go faster stripes, and they put their branding in the middle, and that's only going to disturb the purpose of the shoe. Would that be?
Yeah.
Okay.
Yeah. And essentially the same thing for the midsole too. So if you turn it back sideways, I want one solid piece of midsole material through the middle. And so, I mean, that one's got a pretty good one, but that, you can usually take a look and tell by color, usually, that there's different chunks that have been glued together.
Yes.
And that it's not just a solid piece. And so
you're not a fan of the, when it has the slightly darker on the inside of the shoe, which was quite, I don't know. I haven't seen it recently, but I think it's still out there, isn't it? And you're not a fan of that. You want the form to look fairly uniform as well.
Yeah. Just and try to keep it as simple as possible. The more things that you have to glue together and piece together, I just think that's just increasing the risk of giving you that lumpy pillow effect at some point. And
then for your, looking at the inside and the outside that we were just doing, the left versus right hand side, and the back versus the front, are you looking to typically have for yourself any kind of tilting outwards or inwards, or do you prefer when you buy the shoe new, it's like, I want the shoe when I get it to be pretty neutral, and then when it starts to look a bit tilty, as in the outside of the heel or maybe the outside of the forefoot or the inside of the forefoot is wearing out, then I'm going to replace, because I want things on my foot to be fairly flat and not make anything any more difficult than it needs to be. Is that how you approach it?
Yeah, it is. So I try to keep it, I know what my abilities barefooted are, and I'm pretty happy with the things that my feet can do. So if I put a pair of shoes on and I really struggle to come up onto my toes from a single-legged squat, or I just feel wobbly in them, I put them back.
Okay, so you literally do that in the shop. You put that on your foot, you do a little squat, you're on one foot as you come up?
Yep. So I try to keep your single-legged,
and you try and keep your knee bent a bit and come up into a sort of onto your toes, and then you see, do I feel like I'm able to keep myself steady, or am I being tipped over? Is that okay? That's a really cool way of, because anyone can do those things, right, in a running shop. And I think then you've got a better starting point than, I think the video camera in the running shop is less common now, but it still happens.
Yeah.
But it's also like, it's something useful. You can go in with some sort of sense of, okay, this is how I'm going to assess my shoe and try and figure out what it's doing to me, and then leave with what you think will be a relatively neutral standing point. And then presumably if you've got some sort of problem like, knee pain, heel pain, Achilles pain, you'd be working with a clinician who could perform those same assessments and then sort of use their reasoning to try and determine what kind of shoe might be better for you. But that isn't really something a runner would try to do on their own.
No, but I mean, essentially you can, as a runner, you could do that. So, you've had a pair of shoes for a few months, say you do a lot of miles, and you go to just test it out and put it on and do that same dynamic heel raise task. And if it's hard to do, it could be an indicator that your shoes aren't doing what they're supposed to be doing anymore.
I'm going to steal that little test to use with my clients, definitely. So you get them to do it in their bare feet, and then you get them to do it with their shoe on, and just see the difference. Do they look significantly less stable with their shoe? Yeah. Okay. That's an interesting way of looking at it.
And the flip side of that is that if they can perform it much better in their shoes than they can barefoot, it means they're highly reliant on that brace, and that there needs to be a different treatment pathway in getting them strong enough to be able to do things barefoot. I think that it's real difficult to train runners, especially if you think about marathon runners or something like that, and they can't do heel raises.
Yeah.
Especially barefoot. Like, you spend a lot of time doing heel raises over and over again, and if you can't do it barefooted in a clinical setting, you're just setting yourself up for lots of injuries down the line, I think.
Yeah, I mean, we haven't really touched on, I don't know what you think. I'd say it's more important that the physical preparedness of the person, you know, and their approach. So if they quadruple their mileage 1 month to the next, you know, it's not really going to matter how perfectly well they've selected their shoes, you know. So that,
yeah, that's right.
But the shoes is a part of the injury, I don't know, puzzle, I guess. But it's not the only part. So, I'm conscious that I'm using a lot of your time, but I did have one question that I really wanted to ask. Let me check. Sorry. So, where do you see, or where would you like to see things go in terms of how we think about shoes? Do you think these categories that we have, would you rather we just didn't have those, or do we just need to refine what they are a little better? I guess I'm asking, what's the future for your research, and what would you like to see happen with shoes in the future?
Oh yeah, I would really love some synergy between footwear manufacturers, places like the International Olympic Committee, running stores, clinicians, runners themselves, coaches, you name it, that we can all speak the same language. Because if you told me you have a neutral shoe and you showed me that, I go, no, that's a trail shoe.
Yep.
So having some sort of information, whether it is an actual definition where we are very clear that it's not a neutral shoe, it is a trail shoe. It might have neutral properties, but it's still a trail shoe. It's not the same as a neutral shoe. If we can establish something like that, it would probably be a highlight of my career, because in order to do that would be something along the lines of a Delphi study with top running researchers in the world, which I would absolutely love to have that opportunity to do. So I mean, it would definitely be a highlight if I was able to see something like that through. But then, you know, from the bigger picture, having manufacturers be on board and care less about their year-end statements and more about what they're actually producing for people. There are some brands out there that are a bit more along those lines, but they're still competing with the top dogs. So it's just a complete paradigm shift for everybody to, I don't know, to be more conscious of what we're doing to runners and to people that wear the shoes. Less marketing crap and just a bit more truth and honesty would be excellent for me. Yeah, because I do think about that bigger picture, and osteoarthritis is a huge issue across the world. And I don't know, are we actually causing it, and who's responsible for that? So
yeah, and we didn't talk about the actual statistics on running injury rates, but they are very high, right? Higher than other sports, although it depends what study you read, but it's somewhere in the ballpark of 50% of runners will get injured in a given year, I think is often the sort of statistic quoted. So these are, if the shoes are a part of that, you know, at least having the starting point to say, this is what this shoe is, then we can look at how that might influence injury risk. Yeah. And you were saying about a Delphi study. Now, I'm not entirely clear on this. So that is, what I believe, where you gather a group of people who are the most renowned experts in a field, and then you try and come up with a sort of consensus statement on what terms we should use for shoes. Is that what you were describing?
Yeah. So essentially, there is one for a minimalist shoe, but none of the other types, or whatever you want to call it. There's a few things that are out in the literature that says, that it falls within these parameters, but the study I just did on the websites is there's really no distinction between a minimalist shoe all the way up to a maximalist shoe, in terms of some of the specs and stuff that are reported. So, in so many studies, they say that they used a neutral shoe because it was a X branded model. But so if we're using the manufacturer as the dictator of what type a shoe is, they need to be reporting a lot more things about the shoe so that we can actually make informed decisions about whether or not it is a neutral shoe. But then we don't have that that criteria to categorize it against. So it's kind of a chicken and an egg situation that I think would actually probably happen at the same time. If I could get a good Delphi study going, there's enough of those people that are involved with manufacturers as well. And I think it should include footwear manufacturers too. Yeah. So it's not just researchers, but it would be a really wide base of people involved. And like I said, probably a career highlight for me.
Yeah, no, that would be really helpful as a clinician. And I think for runners as well, we just saw an example of you and I, right, who spend probably quite a bit of time, thinking about running shoes. And we're not on the same page on what shoe this is. Right. I thought it was a different shoe to what you did. And in that study you mentioned with the physiotherapists and, what they believe about running shoes and what they do, it was all over the place. And that certainly reflects my experience, speaking to retailers, to runners, to other clinicians. We all talk mixed, sort of cross purposes, because we don't have an agreement on what the terms mean when it comes to shoes. And it's incredibly confusing. And it must make doing research on it incredibly hard.
Yeah. I was very humbled when I had my PhD examined, because I had some amazing examiners, and the first thing that they said was, "Well, good job on trying to tackle this." And they were very, very lovely to acknowledge the difficulty of trying to do something that is assessed for a degree that is as difficult as footwear. And so if there's anybody listening that wants to do a PhD on footwear, just take some advice and don't do it.
No, I had a similar issue last year. I sort of decided I was going to dig into orthotics and just spend a lot of time trying to understand what we know. And oh my word, it's so confusing. If you've got foot posture, then you've got orthotics, then you've got shoes, and the research on it is so all over the place and so confusing. It's an incredibly difficult area, I think, to study. But I think what you're talking about here is, for the future, hopefully, some ways we can assess shoes and some agreement on the terms we'll use for them. And I think as well, just for people listening today, it's helpful to know why you might be getting confusing messages from different therapists or from manufacturers. And do you know what I mean? It's helpful to know that the scientific literature is not in a nice bow currently. It's a little bit of all over the place. I think that's helpful for runners, so that they can then sort of take it upon themselves to do their own little assessment of their running shoes and what works for them and what doesn't, and maybe put aside a little bit of the terminology that's being used, because it may not be referring to what you think it's referring to.
Yeah, definitely. And just to, I don't know, ultimately, I think runners are very instinctual, and you know your body better than anybody else is. So if it doesn't feel right, just go get something else. Yeah, just
like your
take it on the
$200
chin.
shoes.
Just go get something else. Yeah. So, or just stop wearing them. It might be a hard thing to do, but it's probably better in the long run. So, yeah, until we can all get on the same page, runners are probably the best people to provide advice for themselves. And ignore the colors, ignore the marketing, all that stuff. It's all just for sale. If you don't like the way a pink shoe fits because you're a girl, but you like the way the black shoe fits because it's a boy's shoe, get the boy's shoe. They're not any different. And they market them pink to sell them to girls, and it's all just a bunch of interesting stuff coming from higher up the chain that makes it really hard to sort through.
Is there any way you'd like to direct people to if they'd like to sort of follow your work in the future?
Yep, just on Twitter. I think it's just Codi Ramsey. I have a Google Scholar profile too. But yeah, I am not a real active social media person. But the Twitter, I try to keep up with my research stuff there.
Cool. And I'll give a little shout out to that other podcast you're on, Shoephoria. It's the words shoe and euphoria combined into one. And the episode with you was excellent.
Yeah, thanks for that.
But if anyone does want to dig into shoes a little more, if you sat through this entire episode, you're probably quite interested. So that podcast is good for if you want to get in the weeds a little bit with what goes into shoe design.
Yeah. Yeah, no, he's quite onto a few things and sits in a different field than me. So it's a little bit different topic, but fun
cool.
nonetheless.